week, and I am so happy to have you join us to learn a little bit more about PolicyMap's platform and the data that we have that will allow you and faculty members and students to visualize social and health disparities. I am planning on doing a combination of presentation via PowerPoint, but what I'd really like to do is go live and share PolicyMap with you and share the new platform as well. I know that we have several of you who are already PolicyMap subscribers online, and if that is the case, hopefully you've had the chance to toggle over to the new platform and take a look at all it has to offer. And for those of you who may not have access to PolicyMap right now, certainly get in touch and let us know if you'd like a trial user ID or a trial site for your university or college, and we would be happy to set that up for you. But really today, I wanted to talk about the data and data visualization and give you some ideas of what is here and how easy it is to view that data. That being said, my colleague Phil Vu is on the line as well, and he will be there to take a look at your any messages that you send via chat. We also have some polls, just two simple ones to get an idea of what you're thinking out there and how we might be more helpful, and what your interpretation is of social and health disparities. So with that, I will ask Phil to enter in the first poll, and we will get started. So it looks like education and poverty is the major thought here, and that's the way I was leaning as well. So be sure and send any messages that you have or questions you have to us, and we'll be more than happy to answer those questions. So as an overview, PolicyMap, the platform, has a number of features, and there is a legacy platform and there's a new platform that our users and trial users can toggle back and forth between. Right now, the new PolicyMap will allow you to easily, quickly make maps, create reports, and find areas that not only meet up to 3 criteria, but now up to 5 criteria. And it's the legacy platform right now that you can upload your own data and download data. So we're in the process of finalizing and making everything available through the new platform. But for now, all of our users have the ability to go back and forth between the two. But when we talk about PolicyMap data, it really is data that informs policy. And these are the major categories of data that are available to our users. And one of the most frequent questions that we do get when we talk to our librarians and faculty members and students is, where is the data coming from? And is it all data that's free data, open access data? The question is that the data is coming from over 150 different sources. And we have a data team that is taking all that data, standardizing it, cleaning it up, and putting it into one platform where it's shareable and where you can look at data from different sources across the same geography and really easily see what's happening within a specific community. What's great is that the users of PolicyMap don't need to be geographers. They don't need to have knowledge of using really sophisticated mapping tools. But from the first day that they open up the tool, they should be able to jump in and view this data on a map, whether it's in a layer or it's a data point or it's multi-layers. So I also wanted to discuss a little bit about what we have been trying to do in response to the current health crisis. And back in March, when we all moved from our office in Philadelphia and started to work from home, our data team really, and our management team really looked into trying to figure out how we could support our subscribers and how we could add more data relative to the crisis, just to help out and to do something. And because this is data that's of the utmost importance to all of us. So I wanted you to be aware of the fact that we do have a standalone mapping tool, which is open-facing, meaning available to everyone, where anyone can go and look at the data that we have available. So at this point, I'm not going to, follow a presentation where we're just going to go through slides of my pre-recorded or thought out searches, but I'd wanted to just show you that you do have the ability to go in and access this map, share it with others, and it's not as robust as our regular PolicyMap platform, but there's some simple and easy questions that can be answered here. And then the other part that I'd wanted to point out to you is that our data team of data analysts have been going out there and working to pull in data and work with the New York Times to build the COVID risk index. They've worked with a group at the Washington Post, and they've also been working with a group at Johns Hopkins University to find data that will inform vaccine strategy. So if you haven't already, I highly recommend that you subscribe to our blog so that you can keep up to date with all the new data that we add, not only related to the crisis, but any new data that we have, and giving you, just the most up-to-date information about what is happening with PolicyMap. And also, I wanted to make you aware of the tool that was there. When you go into PolicyMap, and for the most part, I am going to focus on our new platform. You'll note that, and I'll go ahead, there's a link right here where you can dig deeper and explore new PolicyMap or our new maps. You'll note that in the health menu, and I need to reset this, I believe. There is a special section related to COVID-19. So it will be in here that you will find data related to cases, deaths, and testing related to COVID-19, and you're going to also find information broken out according to disparities, racial disparities. So there is data on cases by race and ethnicity, and deaths by race and ethnicity, and this can very simply and easily be viewed on the new map. You'll note that this new map is a little bit more contemporary looking, and when you toggle over, it's going to give you the actual values. For PolicyMap, this is our most frequently updated data set, and which is new for us because it is updated on weekdays, and you can easily go in and search in a specific area. Just like with Legacy PolicyMap, it is a completely clickable, zoomable map where you can go in and find this data. And you can always work, and in this case, we're looking at just states, but you can take a look at countywide data as well. So really, really simple and easy way for you to find this data. When you take a look at this COVID data, you'll see all of the other data indicators that are related to the crisis. So you'll see specific chronic conditions that are underlying health conditions that make a person more at risk to contracting the virus or dying from the virus. We've also isolated these high-risk populations, and we've also figured out, or we've added more indicators related to intensive care unit beds as we go through second and third waves. This will be, certainly very important to take a look at. And we've pulled out data that we've always had. That's been some of our unique data. So data on supermarket access. And what's really become more and more important is our data related to computer and internet access. So keep that in mind. So if you are a PolicyMap user or if you've never seen PolicyMap before, you should just note that there are all of these different categories of data. And as you move through, and if you're in demographics, you can find data related to specific racial or ethnic groups. You can find data related to specific age groups. So when we're thinking about vulnerability, we can think about people in an older age group. You can find information about people with disabilities. I often say that PolicyMap data is very depressing data, but obviously it's so important to know and be aware of what is happening within a specific community, or being able to visualize that quickly and easily is certainly so important. So in this case, we can go in and we can change our variables. We can see the percent of people in poverty with a disability. As we toggle over, we can see, or we can choose those that are just 30% or higher. We can also adjust these ranges. So really find out, where there is an area of where people are, in this case, probably 40% or more. And we can also take a look at trend charts as well. In this case, this is, a positive trend, where the number of people living in poverty with a disability is declining. So you also have the ability, when we take a look at those charts, to add other geographies. So you'll note at the bottom, we can make a comparison by zip code tabulation areas, or by districts, or by city or county subdivisions, really quickly and easily. And from here, we can go ahead and download this as a PNG or download the data directly. So when we're looking at this demographic data, I highly recommend that if you haven't dabbled or taken a look to see what is here, it's really might be of interest to you. You can see, where there are people with a specific disability, where the veteran population is, veteran population by poverty status. As we move into the second category, which is incomes and spending, you'll note that there's going to be data on per capita income, on median family income, and you can even break that out into single female-headed families with children. And from here, you can get an idea of those areas with a lower median family income. And again, you can play with these ranges, or just take a look at these ranges and see, which areas, might be really critically impacted by low income. Under this incomes and spending, you'll also find data about the Gini index of inequality. And one of my favorite, we have many universities and colleges that use PolicyMap within their social work and public health, and within their sociology programs. There's a school, the Thomas Jefferson University School of Nursing in Philadelphia. They have an assignment where they have their nursing students read a book written by Steve Lopez, who's a Philadelphia area journalist for the Philadelphia Inquirer. And he wrote about an area called the Badlands in Philadelphia. And the zip code for this area is 19133. And if you take a look at this area, and you really just start to delve in deeply into this neighborhood or this zip code, you can really find a lot of really critically important information. And what they have their students do is take a look about data related to incomes and housing and lending, all of these social determinants of health, data on the quality of life, and on access to great education. And it allows the students to learn more about the population that they're serving, or the communities that they're working in. So it's really a great example of how mapping combines or is brought into their curriculum and allows them to see exactly what's happening. If you take a look, here is the Gini index, and if you click on it, it's going to give you the breakdown. So in this case, oh boy, almost 75% of the people within this census tract have an income of less than $35,000. So like I said, it's very depressing data, but it's data that allows you to understand what's happening within a specific community. Let me see, I'll pause for a second to see if there are questions that need to be answered. And I think we can come back to them, but yes, we do have many short videos where we give examples of specific applications, and that would be in our video library. So if you go to PolicyMap support, you'll be able to find that. So one of my other favorite professors who teaches PolicyMap also talks a lot about using PolicyMap to think about vital statistics. And when we take a look at vital statistics, you'll note that there's data on mortality rates for infant, adult, there's drug overdose data, birth and prenatal care data, but just something as simple as exploring life expectancy is just fascinating. And if again, I'm going to stay in the city of Philadelphia mostly because I think it will allow you to, just see how you can explore a specific city or community and see what's happening. But if you do go to specific areas, you'll note, in some cases, life expectancy might be, and I'll go back to our 19133 zip code. And if we click on this, you're in the 70s, 68. So, from the time you're born, your expected life expectancy has already been determined. And we have other data sets that are related to this. But if you go a little bit south or close to the Art Museum in Philadelphia, you'll note that, if you were fortunate enough to be born in this area of Philadelphia, your life expectancy jumps up by 10 to 12 years. So it's just a glaring example of disparity and how a lot of this is determined at birth. And we, in fact, do have a white paper that you can download about how zip codes do determine health. So if this is an area of interest to you or research for any of your faculty members, be sure to take a look at that and share that. When we keep on moving down through these categories, you'll note that there's data related to incomes and spending. So we've already talked a little bit about taking a look at per capita income or area median income, but there's also some unique and exclusive data here. So this is an opportunity index, income by place of childhood, and this again is broken out all people by race, by sex, by race and sex. So you can dice that data, or it's already been diced for you in many different ways. If I'd wanted to just take a look at the Hispanic or Latino population, again, I can see, where there's a higher opportunity. And one thing that we do try to do at PolicyMap is to be extremely transparent about this data. So it looks like this is a great little census tract right along South Street that, the opportunity for advancement or for mobility is higher than it would be if you were in other sections of the city. If you take a look, though, I just wanted to show you that you can always click out to the source, and we have a very detailed data directory that will give you more information about this data. Or you can click on the I, and it's going to give you, information about where the data is coming from. In this case, it's coming from the Opportunity Atlas, a research group from out of Harvard. So we do try and be extremely transparent about this data and where it's coming from. And I think we succeed. There's also data here, and when you see this little P, this means that this is exclusive PolicyMap data. You'll see data on specific consumer spending habits, data on total spending, housing, food at home. And from here, you really do get a good idea on down to the census tract, and you can change these geographies to zip code tabulation areas, congressional districts. You'll see how much people are spending on housing. And again, this is a unique analytic coming from it's qualitative, or actually quality. I apologize. I just want to show you also how you can link out to the data set. Quantitative innovations, and it takes BLS data and census data as well. So some really interesting data here that you might not, if you haven't been keeping up with our news, notice that there's new data also related to medical spending estimates. So information about how much the cost is to the patient for specific prescription medications or office visits. Then there's also data here related to affordability. So how affordable as a percent of AMI is a specific housing unit, and then there's data on housing cost burdens. So what are the renter costs as a percent of income, where there are a large number of households that are extremely cost burdened, and even broken out by age. And again, if I'd wanted to isolate those that are just 68% or higher, I can do that, and I can always change my ranges. So in this case, we found a block group where the people within this block group are 100% cost burdened, and that looks to be pretty steady. And from within the new interface or the new platform, you can go in to this block group or to the census tract and get a community profile report as well. So I just wanted to show you, there's also data on rental housing and home mortgage, but for this block group, we could do that. And also you'll note that you can see these trend charts.
So Chrisanne had just a really quick question about if we have federally qualified health centers, and I believe we have the points for it under the health tab.
We do. So Kristen, if you come over to the health menu, there is a link here for specific health facilities, and you'll note that there is hospitals and there is the regular hospitals and the Medicare certified hospitals right here.
If you go down to, the community health centers, you'll see the federally qualified.
And then here are the community health centers and federally qualified health centers.
And lookalikes.
Oh, do you want me to pull the lookalikes in too? All right, let me go back. Here we go. Let me pull this off for now. I'm going to take this off so you can view this data on a map, and you'll note that you can click and there's information bubbles that give you a great deal of information. If you need to download this data, you can go to the legacy platform and pull that all out as well. And within the next few months, you can do this in this interface or this platform too.
And just to add to that, the filters for the federally qualified health centers are really very helpful because there's a lot of informative different filters to use from.
Great point. Thank you so much. So you'll note here all the different filters you can use, including, and you can just color code these. And one thing that you'll note with the new platform is that with these icons, there's a lot more room for customization. So if you need to make them larger, or if you need to change the color, and if you'd want it to go ahead and change the icon type, you can easily do that as well. So you get the idea from there.
Thank you so much. Thank you.
Thank you. All right, so I believe we were looking at housing and we were looking at information about, well, we didn't hit housing yet, but there is data on home values. One of the things that you'll note is that in many areas of cities, there's a large number of gentrified neighborhoods where the low-cost rental units are vanishing, and this is something that's relatively easy to visualize if you take a look at PolicyMap and you're taking a look at information about home sales, but also if you're taking a look at data related to rents and the median rents, and you can take a look at those changes. If we go into an area of Philadelphia that's called Northern Liberties, you'll be able to see, exactly, what's happening in that area. I'm gonna cut this out. And if I'm taking a look, we can see the median rent and the differences between this area, just between the zip code. And again, being able to see the trend for this block group. and seeing how this is changing and how the rents are rising. It's really pretty striking. And you'll note also that, you can take a look at this by, census tract or by zip code and really, be able to see exactly what's happening within an area and the vast differences in how quickly they're happening. And within housing, there's also housing points. So you can map the HUD multifamily houses and the public housing and the areas with low-income housing tax credits. So keep that in mind. You'll see a lot of data here about renters that are cost burdened and renter affordability, but then you'll also see data related to housing quality. So let's continue with our theme of some depressing data, and we could take a look at data related to lead exposure risk on a scale of 1 to 10, where 10 is a higher risk, and we can see exactly what's happening within that area. Another data point that you can take a look at over this is under quality of life. You'll note that there is data related to brownfields and Superfund sites. So just to keep things nice and chipper here we can find this area with all of this. And if you wanted to even go an extra step, we do have the Homeowners Loan Corporation maps where you can go ahead and look at these historic risk maps and overlay that from here, and you can see these areas where there's poor housing quality and Superfund sites, and really get a picture of of these of these maps and the redlining and the areas where there does happen to be brownfields or lead exposure. So anyway, take that off, but wanted to continue on that theme, just show you that there is an overwhelming amount of information here within PolicyMap, and we won't get to all of the data related to social, economic, and health disparities within an hour, but if you have specific questions as I'm going through, please continue to ask. You'll note that under the lending menu, there is data related to banking locations. There is one new data set here that I'd wanted to point out to you, and that is data on mortgage loan denials. And that again is broken out by race and ethnicities. And you can, just take a look at all of that. And pinpoint those areas. There is a really excellent blog, again, written by Eliza Wallace from our data team that talks about the mortgage loan denials and the effect that has. So take a look at that. You can search through our blogs to see what's there. Also under lending, you'll see information on unbanked households and small business loans. And then you can, if you have two specific areas that you're looking at, you can, toggle between the two and make those comparisons. Here, under quality of life, you'll find information about grocery retail locations and farmers markets, SNAP retail locations. One of the areas, as we mentioned before, was computer and internet access. So where there are a large number of households that only have access to the internet through a smartphone only. And if we zoom out, you might get a better. I'm not sure why that's not showing up, why that's not loading. I know this. Let me see. Let's try this again. I'm sorry. Here, why don't we'll go into computer access, and why don't I take a look without any type of computer. Uh-oh. Did I make a critical error in going live this morning?
No, you're fine. I think you have a lot of stuff going on. You're better off just resetting the map and zooming back down.
Okay. Good point. Thank you, Phil. So here we go. So actually this gives you a good national view, which is fascinating as well. And what you'll note when you're looking at our new maps is that the zoom levels are really, definitely improved. And when you're linking over this, it's going to show you, right now, county level data. that really gives you a good indication. You can also go in and, taking a look at this data, create custom regions as well. So if what you want it to do is, find those areas where there's a larger number of households or without any type of computer, you could easily go in and create a custom region as well. And that link is right here. You can either draw a region, assemble it, and what's beautiful about the new interface is that you now have the ability to edit any custom regions that you create. So that's really exciting. Going back, and then as we go through this quality of life data, the other data sets that I think have always been really, really important are related to, access to transportation, location affordability. So this is really where we get into, besides the healthcare data, some of the meat of our presentation and when we're looking at these disparities. So information on, public transit, what the distance is to the nearest stop, transit stop density, the frequency of service. This is another new data set, access to parks, access to fresh air. It's what we all need right now, so important. And note that if you know that there's a specific data set that you're interested in taking a look at, you can always use the Find menu at the top. And I wanted to just take a look at limited supermarket access. Okay. But here we go. I can take a look at this.
Just a note for couple users, the reason why the loading is a little longer is because we're at a pretty regional map here, and the layers are really small geographies. Yeah, you're looking at
on that.
Yeah, you're looking at track data at like the Mid-Atlantic view.
Okay, good point. Thank you, Phil. So maybe I need to zoom in. Let me go into Allentown. We'll take a look, and we can take a look at our block groups that have limited supermarket access, and then also underneath quality of life. We were taking a look at these points before. Here are grocery retail locations. And again, you can filter out that data by the service level. You can color code them all and see which ones are limited service and which one are full service. So here, whoops, I didn't mean to do that. I just wanted to pull this here. So here I can see that there are, a good number of supermarkets in this area, but in fact they are, and I need to just limited service supermarkets. So they might be corner groceries or Family Dollars or retail centers with less access to fresh, healthy foods. So under quality of life, you'll also find really important information about access to libraries, museums, and other nonprofit locations. And many of our universities and colleges use this, just to take a look at who their community partners might be, who they can work with, and also for community engagement as well. So that's data that can be downloaded. Under economy, you'll find information about specific jobs and industries and vacancies of businesses, the workforce characteristics. But let's stick with our theme of social health and economic disparities, and you'll see that you'll be able to find data about educational attainment and where there are a large number of people with some high school, but no diplomas. And let's go back to right. Let's go back to North Philadelphia to take a look and see what's happening there. And you'll note that you can take a look at this data, and we have a number of points, not related to grocery and retail locations, but data related to where there are schools that are considered great schools. This is data that we license from great schools, and again, you can filter out this data. And you can filter it out by the rating, by the number of counselors, or you can filter it out by the type of school. Most importantly, you can filter it by the rating. So on a scale of 1 to 10, which schools are highly rated and which are not. And if we zoom out, you can get a little bit of a better idea of the fact that the 1s and 2s, or the oranges and reds, are the schools that are the not so great schools. And if you click on, you'll be able to see, information about the rating, why it has that rating, information about test scores. But also, in addition to the great schools data, there's lots of really good data from NCES. So if you take a look, there is data related to private schools, and just some really interesting data when you're looking at this related to student-teacher ratio. And when you go into this education menu, you'll see that as well, that it's not just the location data, but it's also data on the school district statistics. So data on the ratio, on the graduation rates, on the number of students in poverty, on special education students, and data on students that qualify for free and reduced lunches. And obviously during the past crisis, or during our current crisis, when there is hybrid or students learning from home, this becomes more and more of an issue. And being able to find, which specific areas or school districts have a number of students who are receiving lunches. So the education data becomes more and more important. And then there's data also on the cost of college. And this is brand new data from Diversity Data Kids, a group from out of Brandeis that has the Child Opportunity Index. And from here, you can see, this area that we've been focusing on, very low. If you go down to this area next to the Delaware River in Philadelphia, much higher, and it tells you why. Because of the education level, because social and economic levels, and health and environmental levels. So, really fascinating data from Diversity Data Kids. There is also a blog article on that, I believe. So for many of our PolicyMap users, the data that we have on healthcare is really of utmost importance to them. And this is data not only on these data points, but more importantly, it is the data for specific health conditions. So data on specific chronic health conditions. And again, those small p's means that it's exclusive data. Our data team has done extensive analysis on these areas, taking data from ACS, from the CDC Burfist data, and they've done their own small area estimates on finding this data. So for many specific conditions or diseases, you can find data, but it's going to be county level data. It's not going to be these small area estimates. So here we can see for the census tract, there's a higher level of adults ever diagnosed with COPD, emphysema, or chronic bronchitis. Again, we can go in and take a look and change our ranges to see where there's higher ranges as well. And what we can also do is we can do multi-layer maps. So again, I'm going to reset my map just because I've been a little all over the place and really stressing the, let's go back to Philadelphia though. And now you can do multi-layer maps. So if perhaps I wanted to go in and I'd wanted to find a large number of people, or I want to find where people are who are living in poverty, I can do this by race or ethnicity, by age. And I apologize. I'm not sure why I'm having trouble here. I think I probably, let me see. Let's try this again. Just take a look at poverty, people in poverty, all. Here we go. And you'll note that, again, we can use these sliders, or we can put in, maybe I just wanted to do 20%. And now I can look at other conditions. So maybe I wanted to take a look and see where there are a large number of people with a specific chronic condition. So I can take a look at COPD, or I can take a look at diabetes. You'll note that we can add up to 5 layers at this point, and we can and or those layers. If I click through, I can see 10%, and I can zoom in and I can add, another risk factor that we've learned is obesity. So we can take a look at obesity rates or overweight. And again, and at this point, we can, even put on these data layers as well. So before we were taking a look at community health centers and lookalikes, and we can map. Another data layer we have is medically underserved areas. And this is thematic data, so we can go ahead and just choose the specific ones that we want: medically underserved areas, medically underserved population. And when we click on this, we'll be able to find those areas that match all the criteria that we've laid out. For this specific census tract, we have a large percentage, almost 70% of the people are living in poverty, and they have a high incidence of obesity, and almost 15% of the adults have been diagnosed with diabetes. So another feature is you can get a community health report. This report is an extremely robust report that is a community health needs assessment. And this is available for census tracts or at the county level. And if I generate this report, you'll see a lot of the underlying data that I've been walking you through about access to healthcare, specific health behaviors, morbidity, mortality rates, social determinants of health are all available here within this report. And from within this report, you can download the data. You can take a look at these changes over time. So you'll note the population growth is up over 16% for this area. The majority of people living within the census tract are of working age. You can see the breakout by racial and ethnic groups, access to healthcare, dental rates and physician rates. And we already noted that this is a medically underserved area. So there are no hospitals or mental health facilities or nursing facilities within this area. There's data on access to health insurance and also information about specific behaviors within this area. So this census tract related to Philadelphia and the state. So city and statewide comparisons. Really, really thorough report pulling out all the data that we have related to healthcare, and not just the specific health conditions. Again, we take a look at the drug overdose death rates. They're not available at that small level, a census tract level, but they are available in the county and state level. Data on food security, farmers markets, and then these social determinants of health. So data on crime from the FBI Uniform Crime Reports and data on educational attainment, showing these trends in here. So, extremely useful, and what previously might have taken someone who was trying to collect this data for a report or for grant applications, it might have taken them weeks to compile this data, but we've simplified the process. Oops. So there are your reports. Let's go back to regular PolicyMap, and we're running low on time. I know that Phil has another poll that I am going to ask him to put up there for us all.
Seems like all are important to everyone, but I think the ability to convey complex data is very important. And I think the 3-layer maps tool or the multi-maps tool is probably one of the most unique features to be able to do that. All right, that's a lot, everybody. Great answers.
Well, wonderful. So there's just a few more things that I'd wanted to point out to you. And like I said, within 1 hour to sort of throw all this information out at you was very difficult. But I'd wanted to give you an idea of how easy it is to map and to visualize this data pretty quickly and easily. But we wanted to talk a little bit about some other data sets that are unique or might be of interest to you. And there's 2 remaining ones that I'd wanted to. And I'll go back to our single layer maps. And the one that I think I wanted to show you is there is number 1, social vulnerability levels. And again, you can take a look at this at the county and census tract level and find those areas of higher social vulnerability or lower social vulnerability. When you take a look at this, it's going to tell you why. And you can take a look when you're looking at social vulnerability in our quality of life menu. You can search by socioeconomic categories or household composition. And again, this is data that comes from the CDC. And this area is considered highly socially vulnerable because of socioeconomic categories, minority and language, and also housing and transportation. Another important thing or interesting thing to overlay this with is when you take a look at our boundaries, you can also add flood zones and see where they are on the map. And you'll note when you're taking a look at our boundaries. And actually, are our flood zones here? They used to be. Maybe not. I see our watersheds.
You have to search for it in the data menu.
That's new from the, here we go. So we can take a look at our flood zones and view that on the map. Hold on a second. Did I choose the right one? Hold on a second. I don't think I did. I went. Well, maybe I'm looking at Philadelphia and that's the problem. So let's maybe go into, we'll go down to New Orleans. Poor Louisiana is really, it might be a better.
There's flood zones in there.
I'm not sure why they're not viewing right now. Okay. All right. So I'm not sure why that's not showing up right now. It might be because we're on the new platform and it's being worked on at this point. So I will, but that's definitely something that's.
It's because you're looking at not the flood zones. You're looking at disaster identified flood zones. You're looking at floods instead of flood zones. Type in zones.
Oh, okay. Let me see.
Or the word flood zones.
I am sorry, everyone.
There we go.
There we, okay. I was gonna say, I thought there were some flood zones in Philadelphia, but, and also if we, so here are the flood zone maps, but then also if we take a look at social vulnerability.
Oh, now there are 2 layers.
Oh, we can't look at them together. Okay, I gotcha. All right, so I'm causing, but I need to do a multi-layer map to do that. So we get that idea. I apologize for my klutziness with that, but you get the idea that those 2 different layers are there and they can be viewed in a multi-layer map as well. And then the other data set that I wanted to point out to everyone is the social needs index. So if you take a look at, and I believe it was under, I'll just type it in the data menu.
It's quality of life.
Is it under quality of life? I thought it was in the federal guidelines because the social needs are related to the opportunity zones. And let's go back to, and here, if we're taking a look at the social needs, I'm looking at this as I want to take a look at it as a single layer. Apologize. Here you can see on a scale of 1 to 10 areas of higher social need. This is a think tank called New Localism Advisors that created, and well, actually it's from Brookings and New Localism Advisors, and they're taking into account information about the people in poverty, or the percent of homeowners who are burdened, or renters who are burdened. So a lot of the data that I've been pointing out to you and discussing with you earlier. So being able to visualize area of higher social need is really, really critical. And many people do take a look at the social needs and they overlay that with the opportunity zone data so they can find areas of potential investment that qualify for federal funds. So that is there as well. So we have just a few more minutes. If anybody has any specific questions, I would love to hear them. But I'd also like to reiterate if there is any interest in further training, or if you wanted to have a trial so that you can really dig in, or if you're a current user and you need more support, please certainly let us know. We can provide you with any help that you need, but definitely make sure that you take a look at the PolicyMap support page. And there is a great deal of information. There's quick guides, there's tutorials, there's a public training calendar twice a week. But this was really meant to be more data specific and talking about the data that is there that allows you to measure disparities. So do we have any questions?
I mean, there was one just to see if we can show a county health report for Nassau County.
Sure, I can pull that up. It might take, or if you want, you can. You are more than welcome to send me a message.
Yeah.
And that way I can send you a report and share that with you. So I'd be happy to do that.
We can definitely share that. And then another question is regarding additional trainings for universities or current subscribers, and we are always happy to give sessions for that. So yeah, right. We can definitely reach out.
Definitely. Right now, when we're doing everything virtually, it's great to have a conversation and talk to our subscribers and learn what they're doing. So definitely, let us know if we can help.
Yeah, and then just a final thing for anyone else, we have recorded this session, so we will share it with everyone afterwards, as well as a follow-up email with any additional links that we might have mentioned.
Okay, and when it comes to trials, generally they run about a month. If you need, 2 weeks or 6 weeks, we're pretty flexible. So, just let us know and we're happy to work with you. All right, well, I thank everyone for spending an hour with us this morning. Enjoy this day. Take care and stay safe, and we hope to hear from you again. Thanks.
Thanks, everyone.